even that small amount of THC could show up on a drug test. So it's important. Patients that we talk to and discuss certain types of therapy, one of the first questions is, are you concerned about drug testing? We have one product, which is a CBD isolate. I have police officers, active military, people with CDL license, captain license using this because I know that this has 100% CBD. It's a CBD isolate. It is the only company that's recognized by the physician desk reference. In fact, I'm on the medical advisory board on this company. It's the reason why I like being part of this company is because it's affiliated with the physician desk reference and recognized by the FDA as a very good company. So I am 100% sure that people that take this product that are worried about drug testing will not have any presence of THC in their drug test. Interestingly, one of my patients had sent me a notice from the Department of Transportation, and what it does say is if your drug test shows that you have THC, an explanation cannot be that you're using CBD. They will not take that as an excuse. So that's important to know. The other products that we have are mostly full spectrum with a little bit of THC in it. Then there's a broad spectrum, which is a CBD medication, but it has no THC, but it has something called terpenes. And terpenes are important because those can help you with different types of issues. They have isolated terpenes to help with certain types of problems. For instance, CBNs, they help more for sleep. So when you look at a product that says that it's for sleep, you want to make sure that CBN's in that. So there's a company that we like that has different types of medications for different medical issues depending on the terpenes in it. It has CBD in it. It is a full spectrum medication with a little bit of THC, but it has the terpenes that are more specific to that issue. So this one is relief, so this one's better for pain. And then they have one that's dream, and this has the terpenes that are specific for sleep. And the other two that they have is boost and focus. Focus obviously help you focus. Boost is better to help you. The CBD is in these products, but it's the terpenes that are specific for your mood on boost and for your focus. So a broad spectrum will tell you that there's CBD in the product, but it's not that there's no THC in that product. So that's important to know about broad spectrum medications. The ones that I just showed you were full spectrum medications. So mainly what we have are isolates, which is this one right here, not to confuse anybody. And this is a CBD isolate tincture, no THC. The rest of the medications we mostly have are full spectrum with CBD and a small amount of THC in it. Now I think if you said to me, what do you think would be better, an isolate or a full spectrum? If you do not have any issues with using THC, you're worried about drug testing, there are studies that show that full spectrums work better than isolates. And I think if you use an isolate, when we discuss dosage, I usually explain to them you might need a little bit of higher dosing. And the reason is THC, that small amount in full spectrum, and the CBD work together in a synergistic effect. They call it an entourage effect because they both work at the endocannabinoid receptors of CB1 and CB2. They work together for it to work, have a better effect. And I've seen that with patients, and there are studies that show that. There's a study that talks about how patients with certain medical illnesses after physical therapy have better effect looking at using it either with an isolate versus a full spectrum medication. It's a small study, but even in my own experience, if you don't have any adverse reason to use that small amount of THC, it does work better. Now, that small amount is not going to give any psychoactive effect. People are concerned about that. That does not happen at all at this small level. So those are the important things to know about when you talk about what medication. First thing I always worry about is, let's start with the proper dose. Again, with anxiety, it's about 15 milligrams to start. For pain, it's 20 to about 40 milligrams, depending on your weight and severity symptoms. Sleep's about 50 milligrams. Next question I have is, are you concerned about drug testing? And that's important in either using an isolate versus a full spectrum medication. And if my recommendation is that there's no, my recommendation is using a full spectrum medication with a better effect. If you use the isolate, you sometimes need a higher dose. Somebody just texted in, what about addiction? With CBD, we talk about side effects are minimal. The THC dose, if it is a full spectrum, is very small. You're not going to get a psychoactive effect. There's no, I haven't seen any studies that show that there's any issues with addiction. I have seen a study, it's on our website, that talks about how it could help with people stop smoking. It doesn't help with so much the craving of it, but maybe more of the cues. But there's no problems with addictions. The side effect profile is so minimal with CBD. And in fact, there's another study that talks about looking at pharmaceutical medications versus CBD, and what the results were was if CBD worked for that medical issue, the side effect profile was much less than that pharmaceutical medication. A good example is, say, Valium for anxiety. You know, when you take Valium, there's sometimes a hangover or a side effect from that medication. With CBD, there really is minimal side effects. Same thing with pain and narcotics. Another good chart we have here is, we're looking at, again, this is the bottom one, effect and dose. And it's not really that good. We send it to our patients. The green curve is kind of like a bell-shaped curve of CBD. You start at a low dose, you get your effect. Taking much more is not going to make it work more, and that's just showing you that the side effect profile is very minimal. Looking at the other two lines, hard to see here, it's the blue and the orange. The blue is more like THC. As you take a higher effect, you're going to see that you're going to get more of the side effects up here, which are maybe hallucination, paranoia, and the orange is the narcotics. You get your effect, but then what ends up happening is you end up getting, start with constipation, you'll get confused, and then if it's too much, you stop breathing. So that's kind of your side effect profile in this area. CBD does not have that, and the reason why is CBD doesn't bind to the endocannabinoid receptors. It makes those receptors work better. That's different than, say, THC and opioids. They're going to bind the receptors, not let them work properly, and then we get these side effects of constipation, hallucination, confusion, paranoia. That doesn't happen with CBD. So it's a really good medication if it works. It really has, the side effect profile is very minimal. So I definitely do have a lot of good experience with it. I'm going to tell you, it doesn't help 100% of patients. It helps most patients. The main reasons to use it are pain, and that's either arthritic pain, that's muscle pain, muscle spasms. It helps with patients with abdominal pain. One thing I have to tell you is that it doesn't cause any ulcers by taking it. In fact, it's very benign to the stomach and intestine. I have a couple of patients that are taking chronic NSAIDs with ulcers and now taking capsules for their pain, and then having no problems with their stomach. The other good things that CBD is for is anxiety. Either taking a capsule every day if you feel like you're anxious all day, or you just take the tincture for your anxiety attacks. And then for sleep, it works very well for. Just the problem is you really need to get a higher dose. Taking the normal dose for either pain or anxiety is usually too small. You usually have to use a higher dose. So those are the main uses for CBD that I see, and I use it for with my patients with my background. There is studies that show obviously CBD with seizures. I'm not a neurologist. I don't work with those type of patients. The one thing that I've read is with CBD and prevention of seizures, the dose is very, very high. It could be up to 1,000 milligrams, and that's for really saturating those endocannabinoid receptors to prevent the potential of seizures. I don't treat those type of patients. That's not my background. But what that does show me is that patients that take it at that high dose really still have minimal side effects. Whereas we're starting with pain, anxiety, and sleep, our dosing is much less and at the lower end of our CBD curve. So we have a high ceiling to work with if patients think it's working. So today I really wanted to go over dosage. Again, the summary is anxiety is the lowest dose, start at 15 to 20 milligrams. Pain, you go from about 20 to 40 milligrams to start. Sleep's around 50 milligrams. And these are initial doses. You may need to increase it depending on your symptoms. It's important to know if you're using a CBD isolate versus a full spectrum CBD medication. They work in the same fashion, except that full spectrum has a small amount of THC that won't have a psychoactive effect, but does usually have a better effect overall because of the synergistic properties of CBD and that small amount of THC. It's also important to know different ways of using it. A capsule's something that takes some time to work. It's going to last pretty much 6 to 8 hours. With a tincture, your effect is going to be much quicker. A topical usually works on contact and will work for an hour or two afterwards. Those are the main points. And everything we talked about today is about CBD oil milligrams. Again, it's also important to know that there's a difference in the description with CBD oil milligrams versus hemp extract oil milligrams. Hemp extract is the amount of flower that's used to make the CBD oil, that product, which is always a higher number than the CBD milligram oil. So the way I describe it is, again, by the endpoint of CBD oil milligrams. I hope this helped. I'll be back again. I'm hoping to try to do this every week. If you have any questions, you can call me at 401-678-6420. Our website is www.basicsllc.com. You can DM us on Instagram. We're on Facebook. We're even on Twitter. So please call us. That's what we're here for. We're here to help you understand how to use it properly. We all have really good quality tested medications. All our medications have lab results if you're interested in knowing that, and that's one of the most important things to know when you do obtain CBD from anywhere, if it's a internet site or a shop. But we're here to do it right and do it safely, and hopefully get the best benefit using the right products. Thank you.